growing weary of running from room to room, practicing one-tooth insurance-driven dentistry? Then stay tuned for the latest episode of The Lionhearted, where Dr. Stephen Rasner will hand you the blueprint for what many call the gold standard of general practice dentistry.
Hi everyone, welcome back to The Lionhearted with your host, Dr. Steve Rasner. Let me start by saying Happy Father's Day to all my colleagues in the world, both male and female, that hold the title of fathers. Happy Father's Day to you. So you know we're in June. And today I want to tell you that I'm going to change the format just a little bit. I think that you'll like this. And the way I'm going to do this, I think I figured this out. I'm not sure. I'm going to I'm going to spend 3/4 of the time or half, depending on the subject, talking to him about practice management gems, how to maximize your success gems. And then I'm going to spend maybe the final few moments, 10 minutes or less, with a clinical tip or even a clinical product that I've come across that I think would help you like it's helped me. And I'm also going to try to make these even a little bit shorter. I don't know what you're supposed to do in this podcast business. I always share that with you. How long you're supposed to make it, how many you're supposed to do. I don't know. You know why I'm doing this. I'm doing this because I got a letter this week from North Africa from a clinician down there that wanted me to elucidate the oral sedation protocols that I've shared with you. Or the docs I've heard from India or Japan. So when I get those things, man, I get pretty inspired to. I don't listen. There's not thousands of you tuning into this, so whatever I was thinking in the beginning, I'm not sure quite. I told you from the beginning. I think I did this to share with you, so it would save you time, and that's what they're about. But anyway, I'm going to make them a little bit shorter, so more like 20 some minutes. So bam, you can hit it on the way to, the store or whatever you're doing, on the way to the gym, as I said in the very beginning, and I think if I give you substance in that time, then it served its purpose, so want to go real quick with the information I always give you if you want to reach out to me, and I really appreciate that you do. Reach out to me and give me suggestions that you'd like to hear me talk about. My email is my name. It's Dr. Rasner, DrRasner @AOL.com. Doesn't get any easier than that. If you want to look and see where I'm speaking or attend one of my courses, then you go to Rasner, RASNER, Institute.com, and you'll see all the stuff that, all the places I'm going to be speaking at, etc. Real quick, really last kind of minute review for anybody in the eastern United States, specifically New York, Delaware, Pennsylvania, New Jersey. I'm hosting the Icon John Suzuki on June the 28th in my office in Vineland. And John's going to share with us his approach to soft tissue grafting, free gingival grafts, connective tissue grafts on both teeth and implants. I mean, if you're into the kind of skills that I recommend that you acquire, then you would certainly benefit from such a program. And it has gotten, I've limited it to like 15 docs, so we are almost there. And then 1 month after that would be Frank Zastro, who's an oral surgeon from Germany. Frank is a rising star. I met him about a year ago. And if you want to check out what Frank Zastro is about, just go on Facebook and look at Real Bone Builders. Real Bone Builders. Frank uses 100% autogenous bone in his approach to augment our bone areas as a site development for our implants. It's really an amazing approach. And, obviously it's not for the brand new surgeon. But those of you, and it's also a great course whether you're a periodontist, an oral surgeon, and yes, even a GP. So Frank's going to be in Vineland, New Jersey, in the later part of the month of July, 19th and 20th of July, the 19th and 20th, and there's still a couple open spots for that. And then lastly, my last atraumatic site development course will be October 4th and 5th this year in my office.
Hey, I actually just filled the last seat for the October course. The next date following that will be February 7th and 8th, and we don't have a brochure up for that yet, but if you email me, beth.steverasner@icloud.com, I'll be happy to get you registered.
In New Jersey, and I've said this many, many times, you can come to this course from anywhere in the United States, as long as you have a license in malpractice active there, and you can learn on live patients. And really, that's the route you have to do. You have to take didactic first, and there's a multitude of places, from Maxi courses to the Mish Institute to multiple places where you learn, you absorb the information for implant dentistry. Then you practice that information that you've gathered on models, and then at some point, I really believe you have to have instruction with live hands-on training. And I'm fortunate to have one of the few places in the United States where you can do what I just said, come with an out-of-state license and perform live surgeries. It's pretty amazing, actually. Anyway, so that's all the information that you need regards to that. I was thinking this morning what to discuss with you in this new format, and I'm going to revisit the blueprint of clinical skills that I would aspire to if I was, starting over. And let's think about it for a minute. And I'll probably get some negative emails on this. If you go through the internet and you look at all the different course materials today that are available for clinicians, you find a lot of overwhelming subjects to take. Should you spend the next year or two improving your skills with sleep apnea, or begin a journey in TMJ treatment, or take the courses on facial fillers and Botox and things like that? And I'm going to tell you something, and again, I think you all know by now where I'm coming from, and I really hope you believe that I'm genuine, and maybe I'm too opinionated about some of these things. But here's my thing. If my blueprint for you would be this, if I had to say it in 1 minute, it would be, okay, focus on the triad that I keep alluding to, the triad of clinical skills of oral sedation, atraumatic extractions, site development, developing the sites where you take teeth out so they can receive implants. And then fourthly, surgical and prosthetic implant dentistry. Now that journey is a journey for the rest of your life. And it doesn't preclude you from taking other courses that you do need. But just hold on there for a minute. If you have those and you're on the journey, so you're already training on one of the three, or let's call it four when we talk about site development, that I just alluded to. And then you do a comprehensive treatment plan, examination, the way I've described in earlier podcasts, and all you got to do is go back and look at them. And just briefly, I'm asking you to look on every patient that comes into you. Unless they're four. Every adult patient that comes into you, I'm advocating, no matter what. Look, we all know they don't call and say, hey, will you do a comprehensive exam on me? But if, no matter what, that your philosophy of care to get to the broken tooth that they called you with, that's why they came to your office, or pain on a specific tooth, no matter what the reason, if you commit to believing, which I don't know why you wouldn't, in examining 5 areas: their periodontium, the health of the periodontium, all the examination of every one of the remaining teeth, their missing teeth and how that plays in to their present oral health or dysfunction. It doesn't always have a tremendous negative impact, depending on how many teeth they're missing or where they're missing them. And the fourth one would be, which connected to that, would be, if you examine their occlusion with the same regard, like how is this affecting what I'm looking at? And then lastly, aesthetics. And not that I don't prioritize or value changing somebody's smile and changing their life. I'm simply saying that I don't know how you can focus on aesthetics without the prior 4 being in a very functional and healthy state. If you do that, I find it hard to believe that you're going to have a lot of room left to worry about taking courses on fillers or taking courses in Botox or even sleep apnea, which I know is a huge and growing part of our industry. I get it. And I don't pretend to know a lot about it. But I hear from so many clinicians that there's a dearth of treatment plans that they're working on, and they find themselves in a one-tooth, myopic, fixing a one-tooth type of practice at a time. I really think for a lot of you, that is due to a lack of commitment to do what I just stated. It is so simple to me. I don't care if you're in Northern Africa, India, Japan, Ireland, or the United States. If you approach that with a sincere, earnest attempt to connect all the dots of those 5 arenas on how that's impacting that patient's oral health, then I don't know how you couldn't eventually be substantially busy consistently. That's all I've done. And it's all I've done for years. And if you want any information on, look, sometimes you got to hear things a 3rd, 4th, 5th time. And maybe that's why I'm reiterating this morning. Maybe you need to go back and look at the podcast on, I had 5 of them, on treatment planning, which were heavily downloaded and viewed. Maybe you need to take some more courses on it. Maybe you need to write to me. But whatever it is, it's in front of you. You didn't pick the wrong profession. That didn't happen. What happened is you quit doing the things that you knew that you should do. And understand that I get it, that we don't all equally have the same skills and talent, which I think is incredibly important when you sit down with a stranger, so to speak, in your chair that you didn't know an hour ago, and by the end of the conversation, you're often recommending treatment that could cost a substantial amount of money. That indeed is an art. And I've told you on earlier podcasts that maybe you need to sit with your loved one or somebody you care that cares about you, your success, your practice. If you don't think you're good at this, heck, you could do what I'm doing right now. You can video yourself and see if you're coming off the way you think you're coming off. And maybe you need to work on things that make you more personable, sincere sounding, even though you are sincere. Or maybe you just need to take courses that strengthen your treatment planning skills. See, one thing that's true that you shouldn't hold against yourself, and that is this: you should not hold against yourself that time has a lot to do, in my opinion, in our profession and figuring out what to do when. Looking at a patient, I know I just said it, I think it's a magical moment in your days and really in the success that you've achieved in your career. That moment when you're figuring out what is the right thing to do when with this patient in front of me. And maybe you do need more courses. And while we're at it, let's just briefly, I don't want you ever to think that all I think you need is a course on courses in oral sedation, courses on atraumatic extractions and implant. dentistry. Now, those three alone can consume you for years and years. But you obviously need other backgrounds, a strong base in restorative. Full disclosure, I haven't been to the Spear Institute in recent years in Arizona, but I know when I went through Spear at Spear's office and John Coy's at Coy's office, it was the foundation to this day for my restorative skills. I know I took a very strong base of occlusion from the Dawson Academy. And I can't speak today as to, is that exactly where you should go first? But you do need a continuum in occlusion. That doesn't mean that you should take off on an avenue, because it's tempting. Because if you're a student of dentistry, like I think most of you are, that would tune into a podcast, for God's sakes. That's why I think you're a student of dentistry. Then you need to understand that when you take these things, a lot of times you get overly excited about the subject that you're learning, right? And that's had to happen to me when I took the Dawson Academy and then advanced and side courses connected to the Dawson Academy. But you got to really think out as to how that impacts how you want to practice and how those skills impact your patient base. Do you really, do you have the kind of practice where you're going to, take CR equals CO models on everyone and mount those and use face bows for everyone and do occlusal analysis and workups? And is that your cup of tea? So anyway, as I promised, I'm going to continue, make these short. The takeaway, I'm going to give you a clinical tip in a second. The takeaway from this today is that I've talked to you about rethinking where you're at right now with your practice and why you've had success or haven't had success at the level that you aspire to. And I've talked basically about the beginning of the blueprint that I think you need to get to the end point that you're trying to get to. And I advocated, which I'm going to continue in the next podcast next week, I advocated my triad, although I didn't elaborate on it, of oral sedation. Why? I didn't elaborate on the why of oral sedation, atraumatic extraction, site development, and surgical implant dentistry. And I've also given you, obviously, and as those of you that haven't heard it by now, if you write to me, I took the time in the last several years to put together a blueprint, literally, of the courses and the number where to call and what I would take and when I would take it. And it's 4 years. What I would take year 1, what I would take year 4. If you want that, write to me at Dr. Rasner at AOL. Real quick clinical tip for my friends out there that do implant dentistry. This is an interesting thing that lots of us don't think about. And that is that we don't always use guides for various reasons. Some of you might be doing dentistry in remote areas, and it's not easy or always capable of having a guide for every case. And quite frankly, I was trained without guides for, I've been doing implant dentistry for 24 years. 21 of those years was without guides, and maybe 20 of those years was without a CT. I get it. And, times have changed. This little trick I came across, I think a lot of us have trouble sometimes, at least according to the literature that I read. If you don't have a guide and you don't have a stent for any reason, where exactly does that initial drill osteotomy site go for the next, for your, like you have a tooth and you've extracted, let's say, 29 and 30. Well, if you just extracted 29 and 30, the socket is your guide. That's a discussion for another day, but and I'll use that at the next podcast. But let's say it's healed, and you don't know exactly, and you don't have a guide, and you don't have a stent for whatever reason. By the way, you should have one of the two. So you should have at least a stent that tells you where to put the initial osteotomy site so you don't end up too close to the tooth or too far from the tooth, which brings you to my product. And these people don't even know that I'm talking about them, and this is called the LM Dental. LM Dental is the name of the company. I believe they're from Italy. And the implant kit is called a MISURA kit. If you Google that, and you can buy these in the United States from your supplier. They're just developed in Italy. And it's just a series of instruments that you go to the size of the implant that you want to place. And it's kind of primitive, but it works. And you place the cylinder. There's 5 different instruments here with different sizes on each tip. And you actually just place the cylinder based on the size of the implant you want. That'll tell you which cylinder to use. And actually there is 10 choices because there's 5 instruments with 2 different sizes on each instrument. You place it against the adjacent tooth, and that is where your initial sight goes. And it takes into account distance from the tooth that you want to be and the size of the implant. I don't know. I think it's a pretty cool thing if you're in a pinch and you're not sure exactly where to put your osteotomy site. Anyway, I hope this has helped you. Next week, by the way, I'm going to take one of my followers that has written to me, asked me about frenectomies, and that'll be my clinical topic at the end of next week. Everybody have a great week. Thanks for tuning in on The Lionhearted.